Welcome again. I am Obani Kestin, and I'll be taking you on the subject physical and health education. We'll be looking at the theme health education. I'll be taking the part 2 of a topic we started previously, pathogens, diseases, and their prevention. By the end of this lesson, you should be able to define communicable diseases and state the causative agents, modes of transmission, and disease factors of measles and mumps. So we've been talking about communicable diseases, and we talked about how microorganisms can infect the body cells and tissues, okay, and cause harm by killing the cells or releasing poisons as they grow and multiply in the body. These microorganisms cause diseases, and they are known as pathogens. These pathogens are bacteria, fungi, and viruses. The diseases can be transmitted through contaminated surfaces, objects, humans, animals, air, food, etc. Some of these diseases are communicable, as we explained, okay, while some others are non-communicable. And we say that communicable diseases are simply those diseases that can be transmitted from an infected host to a healthy person, while non-communicable diseases are those diseases that cannot be transmitted from person to person. There are factors that promote communicable diseases. Now, we refer to these factors as disease factors or risk factors. Disease factors refer to the things or situations that increase a person's chances of contacting a disease. Okay? There are situations that can make someone more likely to contact a particular disease. Okay? We call those disease factors or risk factors. Then we looked at some examples of communicable diseases. We have tuberculosis, herpes, malaria, mumps, HIV and AIDS, chickenpox, ringworm, measles, etc. So for this lesson, we'll be looking at 2 serious communicable diseases. They are measles and mumps. Now, talking about measles. Measles is a highly contagious respiratory infection that is airborne and caused by the measles virus. It is highly contagious. For example, if someone has the measles virus in an environment that is crowded, there's every possibility that, 9 out of 10 people in that same environment will contact that disease, the measles disease. So it's highly contagious, okay? It is also airborne, okay? It can actually, the virus can actually stay in the air and be transmitted to every other person that come into that environment. Now, signs and symptoms of this disease, measles, is fever. When someone contracts measles, these are the signs and symptoms that they are likely to show in their body. Have fever, cough, runny nose, inflamed or red eyes, muscle aches, sore throat, formation of small white spots inside the mouth, and outbreak of red rashes on the skin. Most of the time, this outbreak of red rashes is what we actually see, and we say, oh, this person has measles. But before those red rashes come out through the skin, there are various signs and symptoms that, people that have come down with this virus actually feel. And we've mentioned them. They may come down with fever, headache, sore throats, and then a whole lot of other symptoms that they are likely to show. Now, these symptoms usually develop in 10 to 12 days after a person has been infected. And within these 10 to 12 days that the person does not even know he has been infected, he is likely to infect other people that come in contact with him. Now, the disease spreads very easily. It will affect 9 out of 10 people living together in the same house who are not immune to the virus, okay? However, a person usually is only affected with this disease once in a lifetime. Most times when people contact the measles virus and get the treatment and recover from it, they usually do not contact the disease again. This is because after the treatment, the body, becomes immune to that measles virus that causes the disease. So a person will not be able to contact it again. The measles vaccine is a vaccine that can help one become immune to the disease. So that is why parents are encouraged to get this measles vaccine and vaccinate their children, because when people are vaccinated, especially children, they become immune to the disease, okay? So even if the disease is in the air, someone who has been vaccinated with this measles vaccine will not contact the disease. There are modes of transfer of measles virus. Measles easily spread through contact with the saliva and nasal secretions of infected persons, okay? So when an infected person coughs and sneezes, okay, and those nasal secretions, okay, come out of the person's nose and touches other people around him, okay, they may contact the disease. Another way it can spread is through contact with surfaces or objects on which the virus have settled on. Remember, we say that there are modes of contact. We have direct contact and indirect contact of communicable diseases. All right? So, measles, the virus can actually stay on surfaces. So, if someone is infected with this measles virus and has gone to touch, let's say, a tabletop, and someone else comes in contact with that same tabletop or an object that the person who was infected has touched, there is a possibility for that person to contact measles virus. Another way is sharing eating utensils or drinking cups with an infected person. Disease factors associated with measles. Remember, we said that disease factors are those situations or things that are likely to increase a person's chance of contacting a certain disease. So disease factors for measles are overcrowding. When people are in overcrowded houses or environments, okay, they increase their chance of contacting the disease, being that if someone amongst them has the disease, then it can easily spread there. Lack of personal hygiene is another disease factor. Lack of vaccination. Remember, we say that when someone is vaccinated with the measles vaccine, okay, the body becomes immune to the disease. But when there is no vaccination, we leave our bodies prone to this attack of such diseases. Another disease factor is deficiency of vitamin A. Now, complications of measles virus. These are like life-threatening complications that may arise, especially due to the lack of vaccination against the disease or due to delayed treatment of the infection. So if this infection is not treated on time, these are things that are likely to happen to carriers or infected people. We have severe diarrhea, blindness, okay? Sometimes children become blind when this disease is not treated on time. Pneumonia, inflammation of the brain, ear infection, miscarriage or preterm labor. This is for pregnant women, okay? This complication happens when a pregnant woman with the disease delays treatment. Now, we have treatment of measles. There is no definite prescription for the treatment of measles, but this is what a doctor may recommend when someone already has the disease. May recommend a pain reliever. A pain reliever will help relieve fever and muscle aches, those signs and symptoms that come with the disease. So a pain reliever will help to relieve them. Then a person will also need rest. Rest will help boost the immune system that has been weakened by the disease, okay? Then the person will also need plenty of fluids, needs to drink plenty of water. Then humidifier to help ease cough and sore throat. And then the person will also need vitamin A supplements. When an infected person follows this kind of treatment plan, he or she is likely to recover from the disease. That's that on measles. Another highly contagious disease is mumps. Now, mumps is a highly contagious disease caused by the mumps virus. Now, only human beings can get mumps and spread the disease. So this means that it cannot be spread by animals or surfaces. It's only person-to-person contact, okay, that we can get mumps from. The disease primarily affects the salivary glands, also known as parotid glands, causing the swelling of the glands. Okay, so this is one major symptom of the mumps virus. We see people with this disease, we see them with swollen jaws, okay, because their salivary glands are swollen. Now, symptoms of disease usually develop in 16 to 18 days after a person has been exposed to this virus. Let us look at some signs and symptoms of mumps. These include fatigue and fever, headache. We have muscle pains, loss of appetite, feeling of tiredness, painful swelling of one or both salivary glands. So if both salivary glands are swollen, we see that the person will have double swells on both sides of the chin. Okay, so here we have a summary of the signs and symptoms of the mumps virus: muscle pain, headache, loss of appetite, fever, pain on both sides of the salivary glands, and pain when eating. Because the salivary glands are swollen, people with this virus always feel pain around their jaws when they are eating. Now, the disease easily affects people living together in close quarters. This is why we say that these diseases are highly contagious, because they easily spread from person to person. It is usually difficult for someone to be infected with this disease more than once. So just like measles, when you contact mumps for the first time and you get treatment, there's a possibility that you will never have mumps again. And even if reinfection occurs, it is usually very mild. Mumps can be prevented by vaccinating with 2 doses of the mumps vaccine. So just as measles have vaccine, the mumps virus also has vaccine. So if people, children, adults are vaccinated with this vaccine, they can prevent themselves from getting the virus. Children between ages 5 to 9 are most affected by this virus. It is still a very common disease in developing countries where vaccination is less available. Mode of transfer of this disease: mumps can be easily spread through saliva, nasal secretions, close physical contacts. Some disease factors or risk factors of mumps are lack of vaccination. Of course, someone who has not been vaccinated with this mumps vaccine will very much likely contact the virus when it is around than someone who has been vaccinated. Another disease factor is lack of proper hygiene. Then high-risk environments such as crowded environments with infected persons. Most times such environments are hospital environments, school environments, and public gatherings. So these are risk factors for the disease. Complications that may arise if this disease is not treated on time are meningitis. Such a person may develop meningitis, permanent deafness, miscarriage during pregnancy, orchitis. Orchitis is an inflammation of the testicles. So this happens in males that do not receive treatment of this disease. Then we also have pancreatitis, which is an inflammation of the pancreas. So these are complications that may arise if mumps is not treated. Now we're looking at the treatment of this mumps disease. Mumps disease does not respond to treatment with antibiotics, just like other viral infections. Viral infections do not respond to antibiotics. So there is no specific treatment for it. However, one can manage or treat the symptoms of this disease by doing the following. Someone who has come down with this virus must receive rest, okay? Such a person may take over-the-counter pain relievers like ibuprofen and acetaminophen, otherwise known as paracetamol, to help relieve the fever and the aches that accompany this disease. Such a person may also apply ice packs on the swollen glands. So you may need to use ice packs to reduce the swelling and also reduce the aches. Then such a person must drink plenty of fluids to prevent dehydration. Then such a person must practice frequent gargling on warm salt water. So all we need to do is to boil water on warm water and add salt to that water and gargle on it. Then the person must also take soft meals such as soups and yogurt. This is to avoid worsening the swollen glands. And at third time, an infected person must avoid acidic foods. So with such treatment plan, a person that has the disease will definitely get better and recover from the disease. So with this, we have come to the end of this lesson. In our next lesson, we'll be looking at other contagious diseases such as malaria and pneumonia. So a quick summary of what we learned in this lesson. We said that measles is a highly contagious respiratory infection that is airborne and caused by the measles virus. We now say that treatment of measles include use of pain relievers, rest, plenty of fluids, humidifiers, and vitamin A supplements. Then we looked at another contagious disease, mumps. We said that mumps is a highly contagious disease caused by the mumps virus. And the treatment of mumps include rest, taking pain relievers, applying ice packs on the swollen glands, and drinking plenty of fluids. So we are going to quickly take some test questions based on what we have learned in this lesson. 1. Which of the following communicable diseases can be spread only by humans? A. Measles. B. Scabies. C. Mumps. The correct answer is mumps. So from our lesson, we learned that mumps can only be spread from one person to another. Another question. Which of these is a symptom of measles disease? A. Changes in mental awareness. B. Breakout of red rashes on the skin. C. Painful swelling of salivary glands. The correct answer is B. One of the symptoms of measles that we saw in this lesson is the breakout of red rashes on the skin. With this, we have come to the end of this lesson. Thank you for staying with me. I'll see you again in the next lesson.